Welcome to FNT, Functional Neuro Talks, with Precision Brain Center.
Welcome to our first episode with Precision Brain Center. We're happy to have you here. Today we're going to do a little bit of a deep dive into what functional neurology is and the background of Dr. Gabella and Dr. Blake. So Dr. Gabella, if you'll get us started.
Absolutely. So I'm Dr. Gabella. I'm the owner of Precision Brain Center. And a little bit about me. I did my undergrad at University of Central Florida in molecular biology and microbiology. Then I went on to go to Palmer in Florida. And shortly after, I started my functional neurology diplomate. And then I went on to getting a fellowship in brain injury and rehabilitation. And I worked at Carrick Brain Center for a little while until it closed down. And then I started a practice briefly in Atlanta. Then after that, I moved to Raleigh, North Carolina, where we are now, and opened Precision Brain Center. And Dr. Blake is the associate doc here. So she's going to go ahead and introduce herself and tell you a little bit about her.
Hi everyone, my name is Dr. Blake. So I did my undergrad at Muhlenberg College in Pennsylvania. I majored in neuroscience and philosophy. After that, I moved to Atlanta, Georgia, where I went to Life University and was introduced to functional neurology. I had a vestibular condition, which got me interested in doing the diplomate program, so I started that program. I interned at a large functional neurology practice in Marietta, Georgia for 6 months before joining the team here at Precision Brain Center.
Yeah, we're happy to have her. So today I think we're going to discuss what functional neurology is because it is a new field and that's probably the primary question, especially for patients that are suffering neurological conditions. They need to know what functional neurology is and also how it differs from traditional neurology. So functional neurology is a field of clinical neuroscience. It focuses on brain rehabilitation and we're looking at the functional connectivity within the brain. So a lot of people get a little confused, they'll say I have an MRI, CT scan, everything looked normal. So I'll explain that a little bit. When you're looking at a lot of these diagnostic imaging, they're looking at structural abnormalities. And so that differs a lot from how the brain is actually working and functioning. And the way it functions, how we perform as human beings, or how we feel symptomatically, is going to be due to how the functional connections in the brain are firing. And so what that looks like, if I have an area in my brain that is structurally normal, it doesn't have a bleed, it doesn't have a tumor, but I had a concussion and I created an inflammatory response and I damaged my neuron connectivity, I'm going to have symptoms. Maybe I have some headaches and dizziness and brain fog. And I go in and I have an MRI. That MRI is going to look completely normal. But my life doesn't look normal anymore. I'm suffering big time. And it's because I disrupted the connections between neurons in the brain. So just kind of going to the basic level of how the brain works cellularly. We have neurons, and our neurons, we have trillions of neurons throughout the whole entire brain in the neuroaxis. And when we talk about the brain, we're going to be talking about the central nervous system as well as the brain's communication to the peripheral nervous system down the spinal cord out to our limbs. And those neurons carry out their job by having dendritic connections to a neighboring neuron. And so it sends an electrical impulse as well as a chemical impulse, which is going to be the release of neurotransmitters into the synaptic junction of the next dendritic connection that will lead to the cell body, which is the neuron. And our neurons do this at the speed of light. It's so fast that it happens. And honestly, we've developed a lot with our technology, but our brain is still so advanced, way more so than the technology we have today. And we've learned a lot in the recent years about the brain and neurology, but it's actually so little to what there is to know. So yeah, it's a really marvelous thing. But the important thing to take home is that when you hurt your brain, unfortunately, if you don't have specific types of activation or stimulation, the brain doesn't necessarily heal itself, right? So people will kind of take their traditional approach. I have a concussion. I'm going to go to the hospital, get some imaging done, and then they say everything looks fine. Just rest. Maybe they'll give you some medication, and all of a sudden, 3 months, 6 months, a year, 2, 3, 4, 5, you're still suffering big time, and you're going to provider, and they can't really figure out what's wrong with you from that traditional based model, right? That's where functional neurology really comes in, because it's looking at the functional connectivity. So, for example, when a patient comes in for diagnostics, our examination is generally about 2 hours long, and we're looking at everything that's happening in the brain. And we do VNG, which is going to be measuring eye movements, and it gives us wonderful biomarkers and graphs that tell us exactly what's going on in many areas of the brain. And as a, way to simplify things, our main job is to say what's really good in this patient's brain, what connectivity is strong that we can use and activate their brain, and then what connectivity has been damaged and disrupted. And so there's a lot of overlap between things that we would consider isolated. For example, we have eye movements, we have the vestibular system, we have our balance system, we have our sensory system, and we think of them in isolation, but they're not. The cool thing is these areas are being controlled by hundreds of different locations in the brain, including our frontal lobe, parietal, temporal lobe, all the way down through the basal ganglia, to the pons, cerebellum, vestibular nuclei. And each little cluster of neurons doesn't carry just one job. It carries out hundreds of jobs. So there's this beautiful overlap between the same areas that control eye movement also control my ability to think clearly and sharp and problem solve. It also controls my ability to dampen down my emotions so I don't get super depressed or super down, so that I don't have this crazy outbursts of emotions. Like I get upset at something and all of a sudden I'm raging and screaming because I can't inhibit that emotional overload. Those same areas are involved in eye movement. So how cool is it that we can go in and measure how the brain is doing on things that we can quantify, and then we can use that to activate the patient's brain, create new connectivity, and resolve problems that are involved with emotions and cognition and things like that. So I think I kind of went on a little bit of a tangent there, but this functionality is way different, and we get this question quite a bit, and we try our best to explain things in a digestible form, and then patients just want more. They're like, they want to know more of the science and stuff. So I think that's what we're trying to incorporate today. So I'm gonna let Elena, do you have any questions?
Yes, yeah. I do.
Okay.
So you were speaking about the VNG and eye movements.
Yes.
I don't think the regular person knows what a VNG even is.
Great question.
So what exactly is that, and
Okay.
how do you use that whenever a new patient is doing that inpatient exam?
Perfect. Okay, so VNG, the terminology is video nystagography. So what that means is we're going to pop on a pair of goggles that have these incredible cameras that are sensors, basically. So what it's going to do is it's going to lock on to our pupil, and it has such an incredible accuracy down to like the milliseconds. And we're going to give on the screen, first we're going to look at what's happening in the eyes when we don't have fixation, which means it's dark. My eyes are open and it's dark. I don't have a fixation point to look at. And we're going to see what's happening there. And then we're going to start giving fixation points. We're going to, what we call gaze stabilization, a center dot, and I just look at it. A right dot, I look at it, left, up, down, and I'm just staring what's happening in my eyes. A lot of times concussion, you're going to hear us use concussion as an example because it's well studied, but it's the perfect example of neurological disorders, because we think concussion is one thing, right? We're like, oh, you got a concussion, you must be the same as the person next to you. Absolutely not. Concussion is vastly different in every single patient. It's just, it means you injured your brain. You have a brain injury that came from a mechanical traumatic insult, right? So with a concussion patient, they should be able to look at a fix, or any person should be able to look at a dot and just stay on it perfectly. But that doesn't happen with concussion patients or neurological disorders. So the ability to just do nothing and just stay still. I stay still, I'm relaxed, my muscle tone is relaxed, my eyes stay perfectly still on my target. The only way that happens is if my brain fires inhibitory pathways. So that means my brain is actively inhibiting any motion that would take my eyes off the target. Sometimes it's a fast eye motion. Sometimes it's a slow oscillation. Sometimes it's an nystagmus. It could be a million different things. But at the end of the day, we want to say, how well does our brain just look at something? And that's so powerful because it requires almost every area in the brain to do so. It's really a complex, beautiful system. So again, moving on with media, we're going to then continue to look at smooth pursuit eye movements. We're going to look at them in all different planes. We're going to look at saccade eye movements, and I'm going to let Dr. Blake explain what a saccade is, because I know this terminology is a little new for everybody. So go ahead, Dr. Blake.
Yep, so as Dr. Gabella was saying, so a saccade is when your eyes are jumping from one target to the next, and you want that to use the mechanism where it just jumps doop, doop, right to the next, right then and there. We use this mechanism a lot too when we're reading, so sometimes people may experience headaches because when you're reading, you're jumping from one word to the next, left to right, and during the VNG, we can kind of look at that system and see if it's working the way that it should be.
Yeah, and it's a beautiful thing because when we're looking at saccades, which is a fast eye movement to the next target, we have very different types of saccades. We have reflexive saccades, which means they just happen. We don't do anything to make it happen. Then we have volitional saccades, which means we're actively going to look at a target. And we use this mechanism throughout our whole entire day to map out our world so that we can get up, move around in it, and never have to think what we're doing. So for example, if I have to go to the bathroom, I'm going to get up, I'm going to navigate around the table in front of us, walk down the hallway, go to the bathroom perfectly, and I'm fine, right? If I have problems with my eye movements, I potentially might knock into the edge of the table. I might trip over my toe as I take a turn around a corner. And the reason being is it's called a retinotopic map. It's the map of our visual world that our eye movements create for us, and it's constantly adapting and updating. That map is communicating to our body maps, which is called a somatotopic map. And this is all happening reflexive. It's adapting so that I move around, everything happens great. If I don't have an accurate map of my body, or I don't have an accurate map of my environment because my eye movements failed me and they were not accurate, all of a sudden I go to walk and I'm trying to have a complex conversation with somebody and I forget what I was thinking. Or I can't find the word that I was trying to recall because all of a sudden to think and walk at the same time is too complicated because my two reflexive automatic systems of my body map update and my world map update reliant on eye movements failed me. So that's just to tie that in together. But the awesome thing about VNG is we get these beautiful graphs that are going to tell us the latency, velocity, and exact position that our eye movement falls during these activities. When we look at these graphs, you cannot fake it, right? And we're getting these wonderful numbers that we know, hey, this latency needs to be under 200 milliseconds to have a good frontal eye field. So that's our frontal lobe area. Or this area, or this velocity on the graph needs to be at 500 milliseconds to know there's healthy networks within your substantia nigra and your basal ganglia and your superior collicus, which these are also words that should be relevant within some of the neurodegenerative disorders. But at the end of the day, we cannot fake the data, and it's beautiful to be able to quantify this. And we see this a lot with patients that'll be like, I've gone to see every provider and they don't know what's wrong with me, and they feel like they're losing their mind. And then all of a sudden we have something that you cannot fake that we've been able to measure and quantify and say, okay, well, here's why. Your parietal lobe is really failing you, or your frontal lobe is really disrupted, and you have issues within your lower reflexive autonomic system that's causing a big problem.
Yeah, definitely. And just to piggyback on that too, just because if you have a breakdown in your eye movements, most patients don't feel that symptomatically.
Right.
And that just shows how great the brain is at adapting, because you don't want to feel that breakdown, but
No.
you may be experiencing certain symptoms such as brain fog, headaches. Like Dr. Gabella said before, you may have some trouble thinking about words because when you're walking, all of a sudden you're engaging different systems within the body and your brain is having to work harder. So using the VNG, this really tells us a lot about the overall function of the brain.
Yeah.
And we can explain to you about how these systems are interacting with each other.
Yep, absolutely.
So the BNG, basically, it shows you what the MRI doesn't. Is that correct?
Exactly.
Okay.
Great, Elena. See, this is
Okay.
where Elena is just such a gem because a lot of times I'll go into all this neuroscience stuff and terminology and I'm not able to simplify it just enough for you guys to understand, but that's exactly right. So
Okay.
the examination, the BNG, is telling us functionally what is happening within your brain, right? That is what the MRI CT scan is really missing. So great. That was awesome, Elena. Thank you for that.
Okay.
Okay, so going back to, as I went on that nice little tangent, but we wanted to answer the question, what is functional neurology and how is it different? So the main thing is functional neurology is non-invasive. So we differ from traditional neurology because normally when you go to your traditional neurologist, your options are either going to be surgery, medication, and maybe some other things, but it's kind of limited to that. Whereas functional neurology, we do not use any use of medications. We do not use any use of invasive procedures like surgery. Everything is non-invasive. And what we're doing is we're aiming to activate the nervous system in such a way that we can rebuild connections between these neurons. So when we hurt our brains, whether it's like an acquired brain injury, which is a bleed, or it's a traumatic brain injury, or it's an infection insult, we lose the connectivity, the dendrites between the neurons. So if you can activate that area, number one, we're turning on new gene expression. When we turn on new gene expression, we're going to be creating the protein building blocks that allow us to create the dendrites between two neurons. When that happens, we now have functional recovery. We build new pathways. We have that positive neuroplasticity, and the person all of a sudden feels significantly better symptomatically, but also they have optimal brain function, meaning they can walk down the road and have a complex cognitive task and feel great, nothing fails. And they're not feeling dizzy anymore either. So yeah, functional neurology is a way to get treatment for the root cause of whatever is going on. We approach every patient very, very differently. We take pride in that too because everybody has a different baseline function. Then when you injure your brain, it could be a million different places that get disrupted, and we target that exact area. And yeah, our patients are super happy afterwards. And yeah,
Yes.
I'm going to add.
Oh, sorry, go ahead.
No, I was just going to say, a lot of people ask us too how they will feel after their first session.
Mhm.
And like Dr. Bell was saying, it's great because we are non-invasive. So the biggest thing that we have patients talk about is just feeling very fatigued after.
Mhm.
Because even though it doesn't feel like you are doing a lot, we are really targeting those sections of the brain where we're trying to enhance and create that neuroplastic changes.
Right.
So quick question. You're saying neuroplastic changes. What is neuro, and I heard you say neuroplasticity. So what does that mean?
Yeah, absolutely. So neuroplasticity is the brain's ability to adapt and make change. So we used to, a long, long time ago, think that the brain was static. What that would mean is that when something happens, it is the way it is. I'm stuck with my symptoms and there's no changing it. But the incredible thing about the brain is that's the exact opposite. Our brain is changing every second. For example, if I watch a movie and after the movie I have this memory of the movie, I have now created new connections in my brain that allow me to remember the movie. And so this happens throughout our whole entire life. But then from a functional level, like I'm wanting to perform really well on my job, or I'm an athlete and I'm wanting to perform well in my sport, or I've damaged my brain, I have these symptoms and I can't even live a full life anymore. Either way, my brain is able to heal and adapt and change given the right stimulation. So sometimes people are lucky, their brain will heal on its own. They might be left with a compensation mechanism, but overall they feel okay. Other patients, that's not the case, and they feel awful. And until they get specific and precise activation, their brain stays that way. But the main thing to take home is you're never stuck with that type of symptomatology.
Yeah, thank you for that.
Yeah, absolutely. Yep. Do you have anything to add, Dr. Blake? I know we covered a lot.
I don't think so about that topic, but I definitely do want to touch on about how people who may not experience any symptoms post-concussion, but that doesn't necessarily mean that they shouldn't see a functional neurologist.
That is a good point.
Like we said before, the brain is great about adapting. So you may feel great, but then you come in few years later down the line, you may start experiencing those symptoms. So there may come a point that a lot of times patients say everything's going great. All of a sudden I woke up one morning and I had this intense chronic fatigue, or I had this brain fog and I have no idea what caused it. And then we go through their history. They had a severe TBI 3 years ago. So it can show that the brain, even though it's adapting great, there could still be those underlying things that can show up in examinations that can explain why you're feeling those symptoms that you do today.
Absolutely. So I can touch on, do you think I should touch on compensation mechanism of the brain? I think that'll be helpful.
Yeah, let's do that.
Okay. All right. So our brain is really incredible and it controls everything. Controls our personality, controls our hormones. It even is involved in our organ function. And it's who we are. And if you lose your brain, you lose who you are. So for example, if you look at end stage Alzheimer and dementia, it's a heartbreaking disorder. We treat them and it's super important for them to get treated, but it's a great example of what happens when our brain really gets unhealthy, and it affects so many things in the body. So naturally, as we're a child and we're going through life, if we hurt our brain, it's super important that we have some sort of compensation mechanism that allows us to continue on. So I fall off the playground and I hit my head as a 10-year-old little girl, and I maybe feel a little dizzy, I see stars, don't feel right. And then the following day, I feel fine. Like I'm great. I'm moving through my world. I'm doing great in school. No visual changes. I'm not seeing blurry vision. Nothing's happening. And the reason being is I had a healthy brain initially. I damaged it. And so this area of my brain got damaged. And so what my brain did is it's not going to heal on its own. But what the brain's going to do, it's going to recruit a total different area to come in and carry out this area's function. So what that looks like is I take a cognitive task, or let's say I just take at 10, we're doing a vocabulary test. I perform just as great as I would prior to my concussion on that vocabulary test. But my brain required so much energy to carry out that function because this new area that's compensating for my damaged area, it's going to do so, but it's going to require more oxygen, more glucose, more blood flow, and it's going to be a little exhausting to do so. So I'll perform the same, but it's more taxing for my central nervous system. This goes on throughout my life, and I have another concussion at 15, or I have an upper respiratory infection, or I'm exposed to some toxins, and I keep going, and then all of a sudden, early 20s, I'm in an auto accident, get a whiplash injury, and I was super sharp. I was super successful in whatever career I was in, and now my world is upside down. I'm dizzy, I have migraines, I'm irritable, massive cognitive decline, short-term memory impairment, and I'm like, what the heck happened to me? It was just a car accident. Why am I having all these symptoms? The reason being is my brain, in this story that I'm sharing, my brain went through a lot of insults throughout life, but it compensated really well, and it kept compensating until the last insult happened. And so I'm so compensated in my brain. Every function I do is inefficient and exhausting. So it's putting strain on my autonomic nervous system as it is. And then the last insult happens, and I don't have a healthy enough area to come in and compensate for this last injury. So what happens? The floodgates open, and all of these deficits I had that I was kind of hiding really well and didn't know I had come flooding to the surface. And that's where it becomes really scary, because it's hard for people to understand this was barely anything. Like I barely bumped my head, or sometimes it happens to people and they have no idea what brought it out. It could have been, they lost a loved one or some life stressor happened, and now all these things come flooding to the surface. So that's an important thing to remember, because I think in the beginning, when you're trying to navigate this world of having neurological symptoms, figuring out what is causing it, right? And then where the rest of your life looks like based on these deficits. The main thing to know is it can be fixed, and it's natural. It's a natural process. Our brain is meant to compensate for us and compensate well. And once we have a certain amount of things, things come to the surface. And so there's treatment to get you feeling better. And that's where functional neurology is a really excellent field.
Okay.
Yeah.
So Okay, so let's say we have that concussion patient.
Mm-hmm.
We've talked about the exam that they will get. So the VNG especially will show the areas of the brain that isn't firing well or overfiring.
Right.
So it's the stuff that you will not see in the MRI.
Yep.
After that, what does it look like going on? You were mentioning treatment, but what does that look like?
Okay.
So how do you fix what that person is suffering from?
Yep, absolutely. So within the examination, we're going to be able to quantify and say, okay, these areas of the brain aren't working well, and this is a priority area that we need to start at. So we're going to use the autonomic nervous system as an example. So a patient comes in, they have an imbalance between their parasympathetic and sympathetic, and what that looks like can be very different in each patient. And so we're going to start saying, how can I fire into the brain to activate these pathways in a efficient and strong way? Okay, so I can't activate a system that's damaged and aberrant. So if we use different SSEP or repetitive somatosensory evoked potential, it's a type of electrical stimulation.
Okay.
So for example, I could use some electrical stimulation. I can activate the median nerve on my hands here, right? And when I do so, I'm going to be activating not only this hand area, I'm going to be activating the cerebellum ipsilaterally, and I'm going to get cortical activation, a lot of the cognitive centers in the opposite cortex, okay? So that would be my right cortex. But let's say I have a little twitch, or I have myoclonus on this side, or I have increased rigidity on this side. I need to first say, if I activate my median nerve and I have overactivation of my muscle tone, or I have an involuntary motor movement or movement disorder, I'm activating a bad pathway. I can't use that, right? That pathway is already pathological. So we won't use that. So what we're going in is we're saying what areas are healthy and strong. They're going to synapse and fire into the areas that aren't healthy and strong. And sometimes it looks like different electrical stimulations on the face, because cranial nerves, which innervate our face, are super powerful. Without getting too complex with it, everything is very gentle, feels well, and there's a beautiful way to apply everything. Sometimes it looks like head rotations to a target to fix an abnormal eye movement. Sometimes it looks like eye movements on a screen that we're following and fixating on. Sometimes it could be balance exercises combined with cognitive tasks. We like to do something called multimodal treatment, which means we're going to combine a lot of pathways at once. And when you activate things at once, they get integrated together and you get a bigger bang from your buck. So a faster rate of neuroplasticity in many areas of the brain. And yeah, I could explain treatment all day, but I think ultimately, unless you're a patient, you're kind of like, I still don't understand. And that's normal. It's normal until you experience it yourself. You won't understand, because it is very new and different. And to explain it means to go into all these terminology that is very foreign to most people. So
yeah, it's very complex, but super interesting.
Yeah.
I also just want to highlight that if you're a patient, you're coming in, it may look very simple, but every single thing we do are very specific, very specialized to what you were presenting with. And then we may also be changing it as we go based on what we're seeing. So a lot of other typical offices may not be as individualized, but even with you walking in today, we might be changing the treatment plan.
Right.
So based on what we're seeing and how you were reacting to treatment, everything's super individualized and super specific to your condition.
For sure. And that's the main thing, is we're always re-examining you. So yeah, everything starts at your initial new patient exam, but throughout treatment, a doctor is with you, always re-examining what's going on and adapting treatment to fit what they're seeing in your nervous system.
Very cool.
Yeah.
So you're saying it's very personalized to the patient. So even if you have two patients and they both have concussions and they grew up very similarly, it's still going to be different.
Very different, absolutely, for sure. And so concussions look different in everybody, even in terms of symptoms. So let's say you have two patients that had a very similar, the actual mechanical insult was very similar. They come in with the exact same symptoms. Their brain is going to be vastly different, and treatment will look very different for them.
Gotcha. Okay.
Absolutely, yeah.
Because too, not every concussion is exactly the same. So that's why it's so important too for the treatments to be different, because you're not going to injure the same part of your brain as someone else may have, or the type of injury might have been slightly different. So that's why, again, the examination is so important when you're doing the treatment plan, and why we change as we go based on what we see.
Yeah. One thing I do want to add too, because as people start to watch the podcast, I think they're going to be like, oh my goodness, I have this stuff. I need to get help. Where do I go to see a functional neurologist? So one thing is we see out-of-state patients all the time, but sometimes that's not feasible for a patient. So we want to try to find a functional neurologist close to you. And just like any field, not all functional neurology or neurologists are created equal. They practice different. So we do have a website that shows fellowship certifications of certain providers. And it's a great way to say, okay, there's this provider within a couple hours from me. They have this fellowship, and I think it's great. So one thing we can provide in the link to the podcast is the fellowship website. When you're dealing with anything in terms of brain injury related, one of the best fellowships to look for are the people that have the brain injury and rehabilitation. And we can put a little explanation of where to look there, and to see if there is a functional neurologist in your area. Unfortunately, there are very few of us. So that's one of the biggest limitations when it comes to reaching the population that truly does need functional neurology. So that's also one unique thing about our specialty. We do see a lot of out of state or out of the country patients because there's not a functional neurologist next door to most people. Yeah.
Okay. Yeah, that's very helpful.
Yeah.
Yeah, so we were speaking a lot about concussions.
Mhm.
What other type of patients do you see? So
Great
someone
question.
who is watching this or listening to this, what exactly do you treat?
So really, for our practice specifically, now not all functional neurologists will work this way. We typically will see any neurological disorder. That ranges from neurodegenerative disorders, which are Parkinson's, Alzheimer's, dementia, movement disorders. Sometimes you'll hear about dystonias or Huntington's chorea and different things like that. Tremors fall into that category. We also see any developmental, autism, dyslexia, ADD, ADHD, and it's a huge spectrum for all these disorders. There's people that will come in with certain things that are so mild, and then ones that are crazy complex. I think typically our office does see the more complex patients. We also see the dizzy patient, whether you're spinny dizzy, whether you're rocking on a boat, floating. It feels like the floor is, 2 feet further than it actually is. There's weird disequilibrium type of sensations patients will get, and we see all of them. We typically will categorize that either as dizziness patient or vestibular disorders, is where you kind of get bulked into. Huge overlap though. People can be dizzy and they got dizzy from a concussion, or they are dizzy because they had a exposure to a virus. And and then we also see the headache and migraine patients, whether it's a new headache or migraine, you've been struggling with it for 20 years and medication doesn't work anymore, or you choose like, hey, I don't want to be on medication, or hey, I want to be on medication, I just want to get my brain better and have less migraines. We take that approach as well. And then obviously the concussion spectrum, which falls in the category as traumatic brain injury. We also see the acquired brain injury patients, which it could be an AVM, which is an arterial venous malformation that you're born with and you don't know you have it. And then all of a sudden, one day it ruptures and now you're like looking like a stroke patient, depending on where it is in the brain. Any of your bleeds, okay, so your hematomas, any type of stroke happening is going to be more acquired brain injury. But again, it's a brain injury. It just depends on what was the mechanism of the injury from happening. And then we also see the seizure patients. A lot of practices don't necessarily see them. Again, we take a really big health history. So if there is a patient with a certain symptom that we do not think that we can help with, we will refer you out to somewhere else, and we'll let you know from the get-go. A lot of times we need to do the exam before we know any of that, because even the symptomatology or the symptoms somebody is saying they have doesn't tell us what's going on in the brain, and doesn't tell us if we're going to make a difference for the patient. Again, we're a cash practice as well, so we really respect people's money and also time to getting treatment. And so we're very cautious. We're not going to just take a guess and be treating you and you're spending all this money and then all of a sudden you're not getting better. So we're really, we keep that in mind. It's super important that, time is well spent, money is well spent, and that when you're coming in for treatment, you are getting better, and we're constantly reassessing that and getting symptom updates and things like that. Ticks, all the, there's
So
just
it
about,
varies.
yeah, it
Basically anything to
varies
do
for
with
sure.
the brain,
Yeah.
you guys are on it.
Yeah, like
Yeah.
neuropathy, anxiety, depression.
Yep.
chronic
Anxiety,
Depression too?
Depression is a big one.
Oh,
Yep.
wow.
Yep. Anxiety and depression is a big one. Cognitive decline, brain fog, dysautonomia. That's a big one.
Mm.
We definitely do really well with dysautonomia, and unfortunately, those are the patients that get awful treatment for years before they even find functional neurology. But if you have any form of dysautonomia, that could be your POTS, could be vasovagal syncope, it could be that you get up from seated to standing, you get lightheaded, you have exercise intolerance, and you haven't even been diagnosed, it's probably some form of dysautonomia, and super important to check out a functional neurologist. That is a common area that they'll go to the doctor and they're like, we can't do anything for you other than medication management. And things typically get worse because we're talking about our brain system that controls our blood to every cell in the body at all times. So if that system does not work well, we starve our cells of blood, but we starve the neurons in the brain of blood, and they will eventually die off without getting enough blood supply. So yeah, super important.
Wow. Yeah, that's a lot to wrap.
I know, we covered a lot of ground today.
Yeah. So just if you have just a couple more questions for you guys.
Yeah.
You mentioned that people here that do receive treatment, they also get like optimal brain performance. And you also talked about athletes.
Yeah.
So does that mean that when athletes come here, you can also just treat them to like have better performance?
Oh, absolutely. And yep, that's a huge thing. So an athlete can come in because they have all these symptoms, they're not doing well, and we're going to get rid of their symptoms, get them better. And then you have the athlete that doesn't really have symptoms, but they want to have better eye-hand coordination or reaction time. And it's incredible to see how when you optimize, so basically we're doing an exam, we're going to be very, very particular. We're looking at their functional connectivity, but we're not comparing it to what we consider normal. So we have these biomarkers and we can quantify things in a normal range, but if you look at an athlete's brain, they're not really normal. They're functioning top notch, playing their sport incredible, especially when we're talking about professional athletes. So we're just going to optimize those systems so they're just absolute perfect superstars, and boy, are they super happy. And we have some really good research coming out of the NFL, MLB, some of the professional baseball teams that are looking at what changes in the athlete's performance when we do eye exercises, when we do eye-hand coordination tests, and it's pretty incredible how much better they get. So there's a lot of money to gain with that too, with these professionals. And they're fun because they're easier. When the brain is relatively healthy and you want to optimize it, it's super easy and things happen fast.
That's awesome. So it's like a hack.
Yeah, it is.
Player
Yeah.
then just ends up being to the next level.
Yeah.
That's amazing.
And I will say too, we also have some patients that I treated at one time that were in for a concussion and things like that, and then they just loved it so much, and they're in these high performance careers. They're CEOs, executives, or large companies, and so they're needing to think and perform at optimal level all the time to be successful. And so they choose to come in for brain optimization. So we're not necessarily treating them for symptoms, but treating them so that their brain is, in the top 1%.
Wow, that's
Yep.
really cool. So
Yep.
then they're not foggy,
No.
the brain is sharper, doing
Super
better,
sharp.
better.
Yep.
That's
Make
amazing.
decisions, good decisions, the correct decision on the drop of a dime. And it's a big deal when you have some of these high profile jobs.
Yeah.
Yeah.
So how long do these treatments last?
Oh, that's a loaded question. Okay, so treatment as itself for us is an hour long for each treatment session, but how long in terms of how many times you have to come in? So that's a question that we used to not even answer because we're like, it's so far, some patient come in for 3 treatment sessions and their life is back. They feel amazing. Some patients have to come in for like 50 times, right? And they're choosing to do so. Like we're not saying, oh, in order to get you better, you need to come in 50 times. They're saying, hey, I really like the way I'm feeling. I want to do this lifelong maintenance thing. And they end up coming in for many, many sessions. So at the end of the day, The answer is we don't know, and it is so specific to the patient. However, what we do know in terms of the research is that you could have one treatment and you're going to have positive neuroplastic changes from that one treatment up to a year of never doing treatment again. So that's really super exciting to know that and understand that. Now, if you've been dealing with symptoms for many, many years, that stuff is like hardwired in there, right? And you build compensation mechanisms around it. So it takes longer. So we typically, I think we're recommending, is it 12 to 24 treatment sessions on average? And again, most patients, I would say, within 3 to 8 treatment visits, instantly are going to feel improvements in something, right? But patients generally aren't coming in with just one symptom. They kind of have a large array of symptoms. So sometimes it takes some time to clear out all those symptoms. And the cool thing as well is that there is an exponential growth with treatment sessions. So initially we start off, we're rewiring things are getting healthy in the brain. So we have all these areas that are getting healthy. Then those areas continue to fire a bunch of other areas. So then your next treatment session, you're getting exponentially larger and larger improvements because you get more and more functional connectivity. So you get a really beautiful bang for your buck in that approach as well. I think as a rule of thumb, if a patient is really symptomatic and needs to get better right away, the recommendation is you need to come in more frequently. I think we typically recommend patients when they first start treatment to come in 1 to 3 times a week. I don't think we even have a patient that comes in 3 times a week that's local. And then, some patients come in with minor stuff, and so they don't need to come in but once a month type of thing. But again, we do typically see more of your complex cases. And it's very different for each patient. We're super transparent from the start to finish. And then a lot of these questions specific to the patient can be answered after their initial exam. We explain a lot. We're going to say, hey, here's the probability. Let's start treatment. And with treatment, we're going to be re-examining, reassessing, and we'll have a much better picture of how quickly you're going to get better. And then about the second or third treatment session, we can be much more specific with that patient. Yeah.
Okay.
Good?
Yeah.
All right.
I don't have any more questions for you guys. You guys did an amazing job explaining what functional neurology is.
Thank you.
And what it treats. And I know it's a very, very complex topic. So I know we're going to be talking about this more so in the future.
Right, for sure.
Yeah.
So a lot of these things that were kind of, I know I went on some tangents, told some stories. We'll break it down and explain things in more detail, a little bit slower, discuss things over and over again, and fine tune. This is kind of just to get it all out there.
Yeah, we'll definitely be repeating a lot of what we've talked about today. Right. For our next episode, I believe we'll be deep diving a little bit more into concussions.
That's
right.
We
brushed up on it today, but that's a really important topic that I think a lot of people just have a lot of misinformation about.
Absolutely.
There's so many misconceptions, so it'd be great for you guys to clear some of that up.
Yeah, for sure. We're excited.
All right, well, thank you for watching. Again, my name is Elena. This is Dr. Gabella, and that's Dr. Blake. We're happy to have you guys here. Bye.
We hope you enjoyed today's episode of FNT. Please like, follow, and subscribe to our show, and don't forget to check us out on social media. If you or a loved one are seeking treatment, please visit us at precisionbraincenter.com.